How's it going, guys? So today I want to talk a little bit about some more knee injury type stuff because I know we've been talking a lot about shoulders and other parts of the body, but the knees are one of the most important joints of the body, especially if you are an athlete. You use your legs pretty much in almost everything. So for a lot of sports like jumping, like tricking, basketball, volleyball, and other things like that, your knees, having healthy knees are very, very important. So some of the most common injuries that happen when it comes to knees are ACL and PCL injuries. So today we're going to talk about a few tests you guys can do to kind of measure whether your ACL or PCL is intact, and also some sort of exercises you can kind of do as well that are kind of lighter on the spectrum to kind of help with those things. And then we'll kind of integrate some massages in as well, obviously. So let's go ahead and get started. What are your ACL and PCL and what do they do? Well, your ACL stands for anterior cruciate ligament. Your PCL stands for posterior cruciate ligament. And basically what they do, their basic actions are to prevent your bone, which is your tibia of the lower limb, from sliding forward or backwards. Your ACL prevents your tibia from sliding forward. Your PCL prevents your tibia from sliding backwards. And these are very, very important functions of the body because if your bone is allowed to slide forward, well, it could come out of your knee joint, knee socket, so to speak, and you could be due for a lot of more serious injuries, you know what I mean? So they're basically engaged in everything your knee does, and they're very important to keep healthy because if one of these tears, well, you're out for a long time. So how do we test kind of our ACL and PCL? One of the methods that I like to use, especially when I like to feel how my ACL or PCL is doing per day basis, is to actually use a friction sliding method. So similar to how if you place the palm of your hand on top of a table or something, and you kind of pull it backwards or slide it forward, there's going to be a friction involved between the skin of your hand and the base of the table. And this is actually a good test for our knee as well, because we can do the same thing by sliding our foot against the floor. So if you stand kind of about shoulder width apart and you take a step forward or backwards with the opposite leg, just pay attention to the one you are testing, because whether you are testing the ACL or PCL, your foot is going to be forwards or backwards. And what you can essentially do is you can slide your foot forwards or backwards, testing the friction against your leg and the ground. And what you're going to notice, what basically happens is that it's going to test your ACL or PCL depending on which direction you are sliding, and you're going to feel it in your joint. This is especially more apparent if your situation is worse. So if you are slightly more injured, or maybe you experience some partial tear of your ACL or PCL, you're going to feel kind of pain as you are sliding along. Or maybe if your PCL or ACL is just tight, you're going to feel the tension there as well. And so this not only serves as a good test, but also a good exercise for either ligament, because essentially what you're doing is these are general ranges of motion that your ACL or PCL are going to be experiencing anyways when you are doing sports, whether you are running, you're speeding up, you're slowing down. This engages the ligament as well. And so this is kind of a safe, low intensity way we can stress these ligaments and also train them to better handle these situations. So I would not only use this as a test to see how it's feeling, either ligament is feeling, but I'll also use it as kind of a exercise if you want to improve these things, because healthy ACLs or PCLs, you're not going to feel much tension if you slide or slip your foot either direction. Generally, they will hold pretty well, and generally they will not feel any pain or anything of those sorts under these situations. So that's how you kind of know whether you are, what kind of injury level you are in, or if you should be concerned about your ACL or PCL. If you do feel a lot of pain sliding in either direction or feeling this kind of friction test in either direction, then it might be a good time to see some trainer or some physical therapist or someone who can help you get your ligaments back on track. So that is the general test and exercise. If you're doing this as an exercise to improve range of motion and also the strength of your ACL or PCL, I would recommend 10 of these, at least 3 to 5 sets per day. And what you are going to do is you're basically going to slide friction until you get the tension in either ligament, and then you're going to hold that tension for about 5 seconds. I would also recommend to maybe have something by the side to help you balance, so to grab onto a table or something like that, because you can easily fall if you are focused on that and you're not paying attention to your balance. It's a bit easier to focus on the ligament when you are holding onto something. So that is just what I would recommend as an exercise try to focus on those aspects of the joint. Next up, and you might be curious as to how I would implement a massage into this, but there are always ways to implement massages into any facet of the body as long as muscle is involved. So the ACL and the PCL are predominantly moderated and held together by two large muscle groups of our legs, and that is the quadriceps and the hamstrings. So I would recommend, if you are looking to improve your knee health, or you are thinking about keeping your knees mobile, functional, strong, etc., to consider massaging either your hamstrings or your quadriceps or both. Generally, along the spectrum, our quadriceps, I would argue, get tighter a lot more often than our hamstrings, mainly because they are active in a lot of ranges of exercises. But our hamstrings have a very solid case of getting tight themselves because they are antagonists to our quadriceps. So quadriceps are the muscle groups on the top of our leg. They are in the front. Hamstrings are the muscle groups on the back of our legs, in the back. And these hold onto our knee joints, and they allow them to be more mobile and more strong because they're basically pulling against the skeleton of our body. So if you want to massage either one of these, personally, I'm going to demonstrate with a massage gun. You could take the round ball head of the massage gun and you can go into certain areas of the body that feel tight. So one of the areas of the body that I feel tight are the hip flexors, and there is a predominant hip flexor muscle that is also part of our quadricep group. That is the rectus femoris. So generally I will go to areas that feel like they have knotted up or tightness around this area, and I will either let the massage gun just sit there on the lightest setting. I'll either draw circles or I will go up and down drawing lines. Hamstrings, this might vary depending on your level of activity as well, but one point of the hamstrings that I get really tight in is one of the back ligaments that are towards the left or outermost side or the lateral side of my hamstring group. And this one I will do the same thing, circles, lines, whatever, cross friction, depending on what I need. I would recommend massage gunning for about 30 seconds to a minute or 2 minutes, depending on how much you need. I would play it by a case-to-case basis. So really pay attention to how your body is feeling and give it the feedback that it deserves. So anyways, those are some general introductions to ACL PCL health and what you can kind of do to test whether your joints are healthy, and some massages. You can do these with your hands as well to also keep the muscle groups around them looser, so you can do some more rehabilitative things later. Hopefully these things helped, and yeah, if you have any questions, leave them down below. I'll be sure to answer them. If you like this video, please like the video down below, subscribe to this channel for more things, and I will see you guys in another video. Thanks for watching as always. Peace.